The transmission of this COVID-19 epidemic is becoming more widespread and the situation is worsening. Among the most affected countries is India. India is a city with an estimated population of 1.3 billion. COVID-19 certified cases in India surpassed Brazil, making it to the second largest country in the world. Cases in India are on the rise again after the government is sanctioned, and this has recorded 5,242 cases in a day with 1,000 more deaths. COVID-19 infection cases in India are decreased, but the total number of cases in the country has surpassed 8.5 million. The South Asian country now averages less than 50,000 cases a day, far from its peak last September when it recorded more than 90,000 cases a day. On 2 March 2020, the outbreak of COVID-19 began to occur with 2 cases in India. On 11 September 2020, India recorded the highest number of daily infection cases at 97,570 cases. On 29 October 2020, India continued to struggle with COVID-19 epidemic as it recorded more than 8 million cases. On 19 September 2020, COVID-19 infection case exceed 10 million in India.
Recently, the number of deaths in India due to the spread of COVID-19 has exceeded 100,000 people due to the contagious contagion in the second highest populated country in the world. Indian Ministry of Health data recorded 100,875 deaths, placing the country in third place in the world in terms of the number of deaths due to the virus after the United States and Brazil. The population of India, which is estimated to reach 1.4 billion, is 4 times greater than the US, which was double the number of deaths. This has led to India having reached 2003 deaths on 16 June and starting to record daily deaths in large number.
Next is recovery in India. India reported over 10.4 million cases of the coronavirus as of January 7, 2021, with more than 10 million recoveries and about 150,000 fatalities. The country has been reported new cases of the coronavirus every day since March 2, 2020. While the number of the new cases has been growing, some patients who tested positive under quarantine have made full recoveries. Why the curve matters? The World Health Organization, along with other global health authorities, have been repeatedly underlined the importance of flattening the curve to handle the novel coronavirus pandemic. What does it mean? Simply put, the idea to reduce the number of new cases over a long period to allow people to have a better access to healthcare and recovery without affecting others. If the current trend continues, the Indian health system would be overwhelmed, leading to more deaths than recoveries. The most important idea is to cut transmission rate by practicing social distancing and following proper hygiene routines.
I'm going to present about the step of state government of India has taken to curb the spread of the COVID-19. So, the first one is declaration of curfew in New Delhi and others areas. The curfew, which involves 1.3 billion, the largest in the world, has been enforced since late March and has had a devastating effect on the poor, with millions of migrant workers also losing their jobs. A lockdown order is an order that does not allow anyone to do any activity outside. Just stay at home, residents. There is no movement outside, including to buy food and necessities. In contrast to the declaration now in force, it still allows the people to go out to get food supplies in other necessities. The government is quite cautious in the issue of lockdown and needs to make judgment from all angles. If a lockdown is declared, it involves various parties within and outside the country. Food supplies and various initial preparation should be made. So number 2 is sanitize all places and public vehicles. Union Ministry of Road Transport and Highway advise state and union territories to take all steps for sanitation of public transport vehicles and terminals. This is to ensure sanitation of seats, handles and bars at all bus terminals are disinfected. This ministry also suggested that the public transport should display public health message in vehicles, but terminals and bus stop and ask states and UTs to take expeditious action and mobilize all necessary support in the regard. And the last one is all educational institutions, stadiums and sport clubs in Srinagar are closed from till further orders amid the coronavirus scare as a precautionary step. Under a special set of statutory provision, SMC has also ordered closure of all educational institutions, public clubs, sport clubs, indoor and open stadiums. Coaching centres within Srinagar city limits till further orders. The mayor said the corporation will procure 1,000 full quarantine body kits and spraying machine, and all public as well as private hospital will go into heightened sanitation mode. The corporation also ordered cancellation of all sports events within its limits and pays segregation of flea markets, including weekly markets, with an immediate effect. It has also issued an advisory asking people to resist shopping, especially eatables and garments from roadside vendors. That's all from me. Thank you.